Uh, the, this is our fourth parent forum for school reopening. We'll do some introductions very quickly. Our district superintendent, Dr. Gladys Cruz, and my name is Anthony Taby. I'm the chief academic officer here at Questar 3 BOCES. We are joined by Denise Fernandez-Palazzi, our director of career and technical education, Shauna Maynard, our director of special education, Cindy Heron, our assistant director of special education, Kim Sparkman, our career and technical education coordinator, and Melissa Fox, our special education coordinator. So for those of you that have been part of our parent forums before, we start out with our vision and guiding principles for our reopening planning. Our first priority, as always, is the health, safety, and well-being of all of our entire school community. We commit to being transparent in our communication. We will be intentional about matters of equity. We will build upon strengths and recognize our challenges. We will plan for reopening, multiple reopening scenarios in response to the public health guidance, spanning from full in-person to full remote. We will listen to and prioritize student, staff, and parent caregiver voices by building in regular opportunities for reflection and feedback. And finally, we will ensure that our BOCES and school plans are sustainable and consider the mental, physical, and social emotional needs of our school community. So our agenda tonight is shorter than previous agendas for our parent forums. Our agenda tonight is really going to focus primarily on three areas. That is going to be our testing and contact tracing, and then our remote instructional plan. As we have in previous parent forums, I want to emphasize communication. That is such a critical component of our reopening planning. And if you visit this link on our website, if you go directly to our website, there is a link there to sign up for communication updates. And then anything that we send out, inclusive of links to parent forums, the reopening guidance, resources, everything that we have will be available to you, and we will send out as part of our communication process. So after we go through testing and contact tracing and our remote instructional model, we'll open it up for questions and answers from our participants this evening. So we've gone over this previously as well. Our reopening plan and insurances focuses on all of these areas. Not sure what happened there. Let me stop my share. Just going to try and reshare that screen. All right, that's better. So our reopening plan focused on all of these areas, and we needed to make sure that we covered all of these areas within our plan. And if you go to our reopening plan, which is on our website, all of these categories are covered. So what I want to start out with as we're going through our testing plan is I want to share, so we're going to go over briefly what our testing plan would look like. So we've talked a lot about what the arrival on campus would look like for students, and I want to talk through what the symptom screening process would look like. So in the event that an individual screens confirmed for COVID-19 symptoms while at school, meaning that they have a fever or appear symptomatic with some of the other categories, coughing, sneezing, nausea, some of the other areas that are identified within the screening protocol. they would be placed into an isolation area, and that's for students. If a staff member identifies with any of these symptoms, they would be asked to immediately leave the premises and go home. The individuals would be referred to their primary care provider for evaluation. So if the primary care provider determines that the symptoms are not COVID-19 related, a note from the PCP or primary care provider stating such would be required in order for that individual to return to school or work. If the doctor confirms or determines that the symptoms are COVID-19 related, testing must occur. It is imperative that individuals seek medical evaluation from their doctor. So I want to be able to keep the presentation up on the screen, but unfortunately I'm not going to be able to if it's being manipulated. Let's try one more time. All right. So one of the things that's required is documentation from a healthcare provider following an evaluation, and then that would confirm that that a negative that they weren't experiencing symptoms, or that they were experiencing symptoms and that they were required to be tested. So if an individual tests positive for COVID-19, isolation protocols will be required, and a release from isolation will be determined by the local health department of residency. Any symptomatic student or staff awaiting test results should self-quarantine and will not be allowed to return to school until released by a negative COVID-19 test result. If an individual is confirmed as positive for COVID-19, isolation protocols will be required for 10 days per CDC guidelines. An individual must be in isolation for 10 days and symptom-free for 72 hours before a release from isolation may be considered. So release from isolation will be determined solely by the local health department of residency. A release letter provided by the local health department will be required for the individual to return to school. If a confirmed test result occurs, the county of residency will be notified by the laboratory performing the test. Individuals will also be notified either by the initial test facility or their local health department for negative results. The parent of any student who has tested positive must notify the school district as soon as possible. If this were to occur, Questar 3 BOCES will contact the county of residency for confirmation and collaboration in beginning contact tracing activities. So the Questar 3 COVID-19 school resource person for the school will coordinate that. That is our own Director of Health and Safety, Craig Hansen. So in the event that a student is under mandatory quarantine by the local health department, Questar 3 BOCES will provide remote learning options for the student for the length of their quarantine. So finally, regarding testing, school closure. So school closure decisions will occur in consultation with the local health department. This may involve the closure of a classroom or the entire facility, depending upon the quantity of suspected and or confirmed cases. We've talked about that before, and we'll get into it a little bit further with contact tracing. That is a little bit different from the spring of the 2019-2020 school year. There may be no need to close an entire school building if the local health department determines that the identified close contacts are excluded from school and the facility may continue normal operations. Full closure of a school facility may be necessary, and in some situations will be implemented on a case-by-case basis. So we'll be working with a number of COVID testing sites, and those will be available on our website and also through the county departments of health. So contact tracing. So first I want to start out with what is contact tracing? And the definition of contact tracing is a public health function performed by local public health departments to trace all persons who had contact with a confirmed case of COVID-19. So schools can help this by keeping accurate attendance records of students and staff members, ensuring student schedules are up to date, keeping a log of any visitors, which includes date, time, and where in the school they visited. And finally, assist local health departments in tracing all contacts of the individual at school in accordance with the protocol, training, and tools provided through the New York State Contact Tracing Program. And again, I'm just going to reemphasize this again, that school closure as part of that contact tracing plan, they will occur in consultation with the local health department, and that it may involve a range of either classroom closure or an entire facility, depending upon the quantity of suspected and or confirmed cases. Finally, travel advisory. Any staff or students who travel out of the state to any location listed on the governor's travel advisory list will be required to quarantine for 14 days after returning to New York State. So I'm not going to go into this in depth because we've done this at all the previous forums, but the health and safety outline. So one of the things that we started out just talking about with the was the health and safety screening. So when students arrive on our campus, either for CTE or for special education, they are going to be screened by staff. They are going to have their temperatures checked. And if they have passed all of those checks, then they will be admitted entry into our school facility. Following that, that testing procedure, if an individual is negative or does not pass a temperature screening, so their temperature is 100.0 or higher, they will be put into isolation. Parents and guardians will be contacted, and then we'll go forward with the process from there. Face coverings will be worn by students at all times while they're on campus for instruction. We will structure some mask breaks into our school day for students to make sure that they don't have to wear their masks for the entire time that they're on campus. When we do structure those mask breaks, we will make sure that that students are being kept at minimum 6 feet apart, if not further. Healthy hygiene practices. Again, I'm not going to go through all of these, but if you have been on our campuses before and are on our campuses, now what you would see is that a lot of new signage is present, indicating social distancing, spacing on the floors. There will be also a lot of hand sanitation stations throughout. So in the high touch areas like the entrances, bathroom areas, we'll have alcohol sanitizer stations so that individuals will be able to keep their hands very clean in those cases. The physical distancing, I mentioned that. We also talked previously about the cleaning and disinfection schedules in previous forums. So one of the things that's part of our reopening plan is the disinfection of those high touch areas and in the classrooms. And we, as part of our process, will be keeping a log of what's happening and when it's happening to ensure that all of our high touch areas are being cleaned on a regular basis. Oops. So next I want to just quickly shift over to instructional programming. And before I get into the remote instructional programming plan, I wanted to emphasize again that our plan remains that we are planning to program for 100% of our students to be in person for all of our programs. We are planning for both the in-person instruction and a blended remote model if needed. We have made scheduling adjustments in our programs to accommodate the needs of our students and staff and our districts. And we are trying to minimize the student exposure by creating cohorts throughout the school day. So for example, art class. Instead of having students travel to an art classroom, the teacher would be traveling to the classroom or participating remotely into that cohort class to limit that additional exposure of additional personnel coming into contact with that cohort group of students. We will make sure that not only are we providing accommodations for our medically vulnerable population, but as you know, we did put out a survey to parents asking for their preference for the upcoming school year for the first quarter to indicate whether or not they would like to have their child remote or in person. And that survey at this point has closed, and we are working to coordinate contact with all parents to ensure that we have accurate information. One of the things we have to ensure within our reopening plan is that we have the ability to quickly pivot to a remote learning model if it becomes necessary based upon the testing and contact tracing. So remote instructional programming is going to include both synchronous and asynchronous instructional models. So I'm going to share a graphic on the next slide that goes over that. As I mentioned, students will be grouped by a class cohort. That cohort may include a combination of in-person and remote students, or may just be remote students based upon a variety of factors. To the greatest extent possible, class schedules will remain largely the same, whether instruction is in person or remote, so that students do not encounter scheduling conflicts. And then consideration has been given to prioritize project-based learning and integrate virtual lab experiences when appropriate. All instruction, whether it's in person or remote, will be aligned to New York State learning standards. And again, we've gone over this slide a couple times, but I want to share, I think it does a good job of explaining the difference between synchronous and asynchronous. You can see the clock here next to synchronous. Synchronous is at the same time, real time, live, and it allows for that instant feedback and clarification. It could include live chats, video conferencing, things like that. Asynchronous is at different times, so students would be accessing content that is not live, but recorded content, possibly by the teacher. And this has its challenges, but it's also in a way more convenient and flexible in that if a student needs to rewind or replay something, that they work at their own pace. So that's email, could be a Flipgrid video, screencast, could be just a video from the teacher. So this just again goes into some detail around synchronous learning and asynchronous learning. When teachers lecture or provide direct instruction, we will make sure that that's scheduled in advance and recorded when possible to allow for maximum student access. Teachers will aim to provide virtual face-to-face interaction with students daily, and they will make sure that these times are established and are communicated with students and parents. Small group instruction is encouraged using platforms like Google Meets and Zoom. Particularly the breakout rooms have proved tremendously helpful when we're providing opportunities for breakouts. Asynchronous learning will be used during times of remote instruction, and it will make sure that that even if it is asynchronous, that the teachers remain involved in the learning process of students. Student feedback and assignment deadlines, that's critical, and we want to make sure that that it is being provided to students and it is clear both to parents and students, and we'll be using multiple platforms to do that. So 2 slides left, and then we're going to open it up to questions. We want to make sure that we continue to share what we know, and when we know it, we will make sure that we not only share what we know when we know it, but we will be clear about what we can control and what is outside of our control. We will continue to provide regular updates. We'll use platforms like the weekly update, School Messenger, surveys, forums like this. We'll provide frequently asked questions on our website through a section on our website. Our website itself proves to be a great resource. One of the things that we are also working on is having an instructional hub on our website, which would be accessible by all of our parents and students, so that parents know exactly what is happening within a student's program, whether that's in person or remote. And again, that link there takes you to the sign up for additional communications. We also have an email address set up, covid19@questar.org. You are more than welcome to use that email address outside of these parent forums to have your questions or concerns addressed. We also want your feedback on tonight's forum. What worked well, what needs to be changed for our next forum, which is this coming Wednesday, August 19th. Also, please, if you have a question or if you want us to focus on a particular area for Wednesday night, please provide that feedback to us via that email address, and we'll make sure that those are slides that we include in our PowerPoint. Just to, for instance, the 3 areas that we addressed tonight were based upon feedback that we received, that parents wanted to know what our remote plan was going to look like, and what contact tracing and testing was going to entail. So I'm going to stop my screen share. And I know that we have, I'm going to open it up to questions if there are any questions that are coming in. All right. If there are any questions, please put them into the chat. All right. Well, I would like to thank all of our participants this evening for being part of this forum, and I would like to encourage parents to participate in our forum that is coming up on Wednesday evening. Thank you very much. Does anybody else have anything that they would like to add or any questions? I want to make sure that we're answering every question that comes up. All right, well, I want to thank everyone. We will make sure that the link for Wednesday's parent forum is posted on our website and shared out. And we look forward to having parents participate in our forum on Wednesday night as well. Thank you very much.